Hi, this is Dr. Chu. I'm here at CES 2010 at the Digital Summit booth. We've seen a lot of gateway and medical device technologies today, all working on the Continua standard. We haven't really had a chance to learn much about the organization or the standard itself. So I am here today with Chuck Parker, and Chuck is the Executive Director of Continua, and so I'm going to ask him to tell us a little bit about the Continua Alliance. So Chuck, tell us a little bit about what the Alliance is and what is its mission.
Certainly. The Continua Health Alliance is a 230-member alliance of companies that have come together to really create the ecosystem of interoperable personal health care devices. So what we're really looking at here today is how do we engage in creating a standard for the personal health care devices to flow in a common format so that we can work with specifically in the home particular types of arena.
Now, Chuck, why is it important to develop standards?
Because right now what we actually are looking at is that each multiple device manufacturer today is actually creating their own way of communicating and trying to connect into the internet today. And it makes it completely fractured, so you don't know how you're going to capture that information. Back-end systems can't be standardized and simplified in order to be able to manage those devices effectively. And so by doing the standardization, it makes it much more easier for the individuals to connect, not only individuals but also physicians and clinicians to connect these devices together and ensure that they're going to work together.
Now, it seems like we're operating in an environment where standards, as you mentioned, are important. There seems to be a lot of standards out there. As physicians, we're very aware of HIPAA, for instance. Are HIPAA standards something that your organization has thought about incorporating into its mission?
Certainly. Standards are certainly something that we're here to really define the overall aspect. From that perspective, I would say that HIPAA has been incorporated in this. We certainly have to take a look at the devices and ensure that we provide the appropriate security. So the overall data streams themselves are very defined to be very secure and make sure that we can necessarily pass that information in a secure fashion to the appropriate endpoint, and that information can be verified and securely logged into whatever system it needs to go into. From that perspective, as you mentioned, standards themselves, all of our programs are built upon the IEEE standards, so they're looking at working with the base level devices. Defining them from an international perspective and using IEEE allows us to then create these devices which are very simply defined by these open international standards.
So Continua, as I understand it, is an industry consortium made up of, as you mentioned, 230 members, and the idea is to develop a standard to help support a burgeoning telehealth and telemedicine industry where we can bring together devices as well as back-end servers and perhaps even ASP services to serve physicians and patients. Is that correct?
That's correct. Yes, I think, yes.
And how old is Continua?
Continua is 3.5 years old. We were formed in June of 2006. First version of our guidelines came out January 14th of 2009, and we'll have our version 1.5 enhancements available in the Q2 of 2010 this year coming up. So it's something that we've now seen as we've gone through an engineering cycle. We now have about 10 products that have gone through certification. So Continua in and of itself is not a standards organization. We're a certification organization, certifying that the devices can interoperate and meet the specific criteria for being able to communicate information.
Does Continua work with any federal agencies such as FDA, for instance?
And as an example of that, we actually are doing something in conjunction with the FDA, January 25th and 27th in Rockville, Maryland, in sponsoring some very specific use cases with them on trying to work through some of these details of how can we use these devices and what does it mean to be certified with the FDA as well. So the 510K process.
Now, tell us a little bit about the stakeholders involved. I imagine that you have many different stakeholders, both from the device manufacturers to back-end servers to even companies who are market leaders such as Google and Microsoft who are developing electronic health applications. Can you tell us some of the members of Continua and
Sure.
for us to get an idea of the range of stakeholders you have involved in your organization?
Sure. Yeah, there's several different levels in several different organizations. So, for example, even at our board level, we have organizations like Intel, Sharp, Panasonic. We also have Cisco. And then what's interesting is that it also incorporates healthcare providers organizations. So at our board level, we also include Ascension Health, Partners Healthcare, and Kaiser Permanente. So these are, we have both a broad view here within the alliance. As membership goes as well, we also have organizations like Aetna and United Health as part of the membership. And then we broadly internationally, we have organizations like the NHS, the National Health System of the UK. Clínica de Barcelona is a part of this as well. And then we have the typical organizations that you would typically find who are manufacturers, vendors in this particular case, like an A&D, a Nonin, Omron type of organizations. But we also incorporate and have grown now into this mobile health field and have now been engaging with organizations such as AT&T, Verizon, NTT Docomo, as well as organizations like Vodafone and Orange and some of the other European countries. They see a distinct interest in this particular area, as well as the handset manufacturers such as Nokia, Samsung, organizations like HTC as well, who are seeing that there's going to be a convergence in this particular area, and using the mobile handset is probably a connection point and collection point for the data itself.
Now, David, you mentioned some international companies there as members. Is Continua an international consortium, or is it mainly focused in the United States?
We are international, and we have three. We focus right now really predominantly on three geographies. That's in the Asia-Pacific countries, primarily with Japan, the U.S., and then also the EU nations as well. So those are probably our primary focuses. But we do have developmental groups in Australia. We also have worked in Latin America, and have interest growing right now. As an example of that, we'll hold a summit meeting in Seoul, South Korea this year as well.
Okay. Chuck, thank you so much. This has been really great. I'm going to wrap up with just a few last questions. Can you tell us what's on your agenda for 2010? What's at the top of your list for what you want to accomplish this year?
I think that getting some of the products out there, getting some of the certification, and the use of the Continua guidelines more widely adopted. Having organizations like NHS or the federal government in the U.S. to begin to recognize Continua standards and use them as sort of a baselining for how devices, these personal healthcare devices, should communicate.
Thanks so much, Chuck. Now, for our physicians who might want to learn more about Continua and your standards, where can they get more information?
Certainly, you can go to our website at www.continuaalliance.org.
Great. Thanks so much. This has been a great conversation.
All right. Thank you.